Assalamu alaikum students. This is Ashraf Hussain, your lecturer of Doctor of Pharmacy, second prof, second chapter of Pharmaceutics Dosage Form. Introduction, Dosage Form, Ingredient and Product Formulation. Student, don't skip the video, watch it till the end, and if you have any question, ask in the comment section. So, what is dosage form? Before going to discuss dosage form, we should know about drug, medicine, and the subject that is pharmaceutics. So, let us start without wasting the time. Now, student, what is the difference between drug and medicine? Drug is basically the pharmaceutically active ingredient in medicine. So, drug is not in its actual formulation. So, it is not a dosage form. It is not the physical form in which it is to be administered in the body. Basically, drug means remedy. So, here it is an active pharmaceutical ingredient that is called API. Now, what is medicine? Medicines are the means of administering drugs to the body in a safe, efficient, and convenient manner. So this is also called as drug delivery system. Medicine is basically the combination of active pharmaceutical ingredients and excipients. Now, what actually medicines are and what is the drug? Drugs basically alters that changes the body's physiology, while medicines are the substances, the chemical substances that treat, cure, prevent any sort of diseases present in the body. So medicines, for example, if you take the example of acetaminophen is basically paracetamol. What does paracetamol do? It is basically used in the fever reduction, pain relief. For headache it is used, for pain management it is used. So medicines are basically the physical form. These are the physical form. These are basically the dosage form which are to be administered in the body, so they can go and interact with the body's receptors and shows action over there. Now, drugs are the chemical substances which will bring the physiological changes. So now one can say that a drug is a chemical substance that can bring physiological, biochemical changes in the body's living system. So medicines are basically, these are the dosage forms. These are the physical forms in which the excipients are added. For example, if we take a willow bark, from which methyl salicylate, from which aspirin is to be formed, but we have to add the other ingredients to make its dosage form, to make its actual form. Like we can add the starch, we can add the sucrose, we can add the lactose, maybe binders are used, lubricants are used, even adhesives are used to make its a dosage form. So medicines are basically the actual dosage form, the physical forms in which that chemical substance is to be administered into the body. Medicines are basically in the form of tablets, capsules, ointments. So they have excipients. Now we take a short example of the drugs and medicine. For example, we have aspirin. What is aspirin? It is basically a medicine now. Aspirin is obtained from a willow bark. That is acetyl salicylic acid is basically the drug. That aspirin is obtained from a chemical known as salicin. Basically, salicin is the actual active ingredient that is derived into acetyl salicylic acid, that is derived into aspirin. So it is a synthetic derivative of salicin. Acetyl salicylic acid is the drug, while aspirin is the medication, that is medicine, which contains the excipients. So now the aspirin is used to pain relief, for anti-platelet, that does not form the platelet segregation, that can be used to reduce the fever. So it is basically used in multiple ways for the body. Another example is the acetaminophen. Acetaminophen is also a drug, and it is basically known as paracetamol. It contains the brand names like such as the Tylenol, the Panadol, and Caplol. These are now the medicines which contain the active ingredients. So basically, drugs are in its raw form, while medicines are in its physical form, in the form of tablets, in the form of capsules, even ointments. Even you have the nasal sprays, ear drops. So these are now the medicines. Medicines are basically in its actual form, in its original form, which is administered to the different sites or organs of the body. Student, as we have discussed the medicine and drug, now we comes to pharmaceutics. That is the subject which we are studying. Pharmaceutics is basically concerned with the scientific and technological aspects of drug design and manufacturing. Basically, pharmaceutics covers the vast areas of different subjects in which it involves the development of the medicine at the end. It does not involve its steps of stages like its discovery, synthesis, isolation, purification. So these steps it does not involve. Basically, pharmaceutics is referred as the dosage form. So this is basically the field which involves the scientific and the technological aspects. These methods are used and involved to design a drug during its manufacturing. Student, now we come to the definitions of pharmacy. What is pharmacy? Pharmacy is a healthcare science that deals with the preparation, dispensing, utilization, and preservations of drugs and medicines. The second definition is that pharmacy is an art and science of preparing from natural and synthetic sources a suitable and convenient material that can be used in the treatment and prevention of diseases. Pharmacy is basically, this is one of the professional field, one of the best field which involves the healthcare, means that involves the preparation, dispensing, and utilization. So the drugs is converted into its original form, in its physical form, that is the medicines. That involves the pharmacy. Basically, pharmacy have different branches. That includes the retail pharmacy, community pharmacy, industrial pharmacy, hospital pharmacy. So it is not only a single way that can includes that we have to dispense the medicine to the patient through a retail pharmacy. No, it is not only restricted or it is not only limited to that way. It includes the hospital pharmacy also. It includes the industrial pharmacy where the drugs are converted in its physical form in the industries. So it involves the manufacturing processes also. So pharmacy is basically, it is the art, it is the science which involves the preparation of medicine from the natural or synthetic sources to convert it into a convenient material. Convenient material means that is the medicine, that is the dosage form which can be used in the treatment, in the prevention, in the cure, in agitation. Now student, we come to dose and dosage forms. Dose, what is dose? Dose is basically the prescribed or measured quantity of a drug to be taken at a particular time. What is dose? Dose is basically the quantity, the amount which have to be administered to the patient over a specific time. For example, we say twice a day, thrice a day, once a day, before meal, after meal. So these are just the timing. Now we say the quantity. For example, if a doctor has prescribed 500 mg antibiotics, so it has to be administered at different times. Now different times means it has to be administered with a specific quantity. For example, one says 10 mg should be administered, 20 mg should be administered. So these are basically the amounts. So dose is now the combination of the quantity and a particular time in which that drug has to be administered. For example, we take the example of paracetamol. It has 100 mg, 500 mg, different amounts are present. Now dosage forms. What is dosage form? Dosage forms are the means by which The drug molecules or APIs are delivered to the site of action within the body to produce optimum desired effects and minimum adverse effects. Dosage forms is basically we called previously pharmaceutics. Now this is the medicine. The medicines, these are administered into the body in its original form, in its physical form, to the different sites of body. For example, we take a medicine diuretics, so it will act on kidney. So the site of action is kidney. Now this is the original form of the drug. Diuretics may include furosemide, bumetanide, toracimide, azoximide. These are now medicines which has been converted, and that acts on different sides of body. So basically it produces maximum therapeutic effect, maximum desired effect, and minimum adverse effect, means minimum toxicological effect. So mostly it will have a pharmacological action and lesser the toxic effect. So this is basically the dosage form. Dosage form will include active pharmaceutical ingredients with excipients, which we previously called the medicine. So dosage forms are basically the drug molecules or APIs that are to be administered to the site of action within the body to produce maximum effects and minimum adverse effects. So comes to the explanation. Basically dosage forms are called the unit dose. Unit dose mean non-reusable packaging when each product is individually packed. Once you have packed that product, it will be used once. It cannot be reused. That is not a reusable form. Means it has to be excreted from the body. Now dosage forms are the pharmaceutical drug products which is presented in a specific form for use. It is a specific form. It may be in the form of tablets, it may be in the form of capsules, it may be in the form of suspensions, emulsions, even different syrups are used. So it contains the mixture of active ingredients. It contains the mixture of active ingredients and inactive or inert compounds. Inert compounds are basically the excipients. Active compounds are basically the drugs that are administered. Student, as we have discussed about the dosage forms in detail, that it is a physical form in which the drugs or the APIs are administered to the site of action within the body to produce maximum effect and minimum adverse effect. Maximum pharmacological effect or therapeutic effect are produced. The composition of dosage form consists of two parts, the therapeutic or the active agents that are API and the non-therapeutic or excipients. Non-therapeutic agents are the excipients. Now what are therapeutic or active agents? Therapeutic or active agents are basically the drugs. These are biologically active ingredients that are obtained from the natural source or may be prepared synthetically. Biologically active from natural source include the plants, the animals, even microorganisms are used. It has a detail, very big detail. From plants, maybe roots are used, stems are used, barks are used. As I have given the example of willow bark, from which aspirin is obtained. That is one of the best example. From animal, even pancreas are used to prepare the human insulins, growth hormone, antibiotics are even prepared. Now it has specific half-life. Remember, active agents have specific half-life and expiry date that is extracted from the plant or animal sources. Plant sources includes the willow bark. Even different plants are used to obtain that active ingredient. Animals are also used. So mostly plants are used. 50% plants are used. So it must have to be preserved. It needs extra care. The second part is the non-therapeutic or excipients. Non-therapeutic agents are also called the additives, adjuncts, or the helpers. Now we are coming to the point where we have to prepare the dosage form. Without non-therapeutic or excipients, agents, that active agent is called the drug. But if we use the non-therapeutic or excipients, it become a dosage form, it become a medicine. So these non-therapeutic agents are called the additives, the adjuncts and helpers. It includes fillers, the bulking agent, preservatives like sodium benzoate, potassium sorbate. These are used. Benzoic acid are also sometimes used. The thickeners, which are the rheology modifiers, it includes gum, acacia, gourd. Vehicles includes the petrolatum mineral oil. Instead of a solvent, it can be used like water is used. So these vehicles are also used. Mineral oil is basically used in the emulsions. Colorants includes the tetrazine, erythrocine. The flavorants includes vanillin, mint flavors, and the aromatic oils. So these are what? These are the excipients. There are many more excipients which are used in medicines to be administered in the body. It has several properties which we will discuss. What are the properties of an ideal excipient? The properties of an ideal excipient includes that it should be free of microorganism. There should be no microorganism. If a microorganism is present, the medicine may get spoilage, it may get deterioration. It should be chemically stable. It should be non-reactive and non-toxic. Why it should be non-reactive? It should be non-reactive because it should not target the body's living system. Actually, the active ingredient, it reacts. It should be reactive. The active ingredient should be reactive. So it should be inert to the human body. The efficiency in regards with the intended uses, and it should be acceptable with regards to organoleptic characters. Now we take some examples of the excipients. Number one, that is 5% starch used in the formulation. It acts as a binder in the tablet. So it binds the active ingredients present in the medicine, while dry starch is used as a disintegrant. Disintegrant, it will be used in the gastrointestinal tract to disintegrate the active ingredient that goes to the stomach. pH modifiers include citric acid, tartaric acid, etc. Anesthetics used are chloroform and magnesium stearate. Tableting lubricant. Remember, magnesium stearate or metallic stearate, these are used as a tableting lubricant. Sometimes it also used as anti-adherent, but the most suitable property is tableting lubricant. We take the example of the dosage form as amoxicillin. Amoxicillin is a penicillin antibiotic which is used to treat the bacterial infection. It comes in two forms. The one is that 500 milligram capsules and 250 milligram chewable tablets. So it has two different forms. One is the capsules and the other is chewable tablets. So capsules, it will be administered orally, while 250 milligram chewable tablets, it is just used in the oral or buccal activity, which are prior to swallowing must be chewed.